Infertility is a common problem facing about 15% of Canadians. One fertility clinic in Burlington sees around 2,000 new patients each year, and that number has been a steady increase as infertility has nearly doubled, according to doctors, over the past 20 years.
And we know that from Canadian census data. In 2010, when we looked, the incidence was around 16%, and in 1992, it was only 8.6%. So there's a big shift towards increase that we're really concerned about.
Some say the reasons for infertility are caused by environment, foods, not enough exercise, or maybe even too much. But stats suggest around 46% of women are waiting until their mid-30s to conceive, which does increase the risk. But what goes in your body is a factor for conception. The less toxins, the better your chances.
Well, cigarette smoking is probably the biggest environmental issue. We know for sure that women who smoke have poorer fertility and earlier menopause than women who don't smoke. So of all the environmental issues, I think that's the most important. But things like air quality and water quality, we don't have good data saying that those are important in a big way. So the key thing is advancing female age. So we know for sure that things are fairly stable for women in terms of pregnancy rates up to 36 or thereabouts on average. But past that, we see pregnancy rates going down significantly. So cigarette smoking environmentally is a big issue. Individuals who have exercise addictions, people who really are exercising to extremes, yes, they can have fertility problems. But that issue isn't the key to the increased incidence we're seeing.
There are also three main areas doctors focus on to determine your fertility issues. Rather it is an egg problem, maybe a sperm problem, or the issue of sperm and egg together. There are also several different conception methods which they determine during your examinations.
Patients go and see the family doctor and say, look, I have a problem, and he or she then refers the patient on to us. And the issues they present to us obviously lead us down different treatment options. Fertility isn't just IVF. IVF is the sort of the pinnacle of treatment. That's the last thing we fall back on. But there are medications, there's insemination processes, there's monitoring that we do to try and help people conceive without going to the more high-tech IVF approach.
Majority of clients today are single women or same-sex couples who are looking to conceive and also need donor insemination.
Again, 40 years ago, the majority of donor insemination was being done for heterosexual couples where the husband had no sperm. Now, by far the majority of donor insemination patients we see are same-sex couples. So we help them in the same way as we help other people. They come either as single women or as couples, identifying the issues that they seek help for, and we help them.
And the process of donor insemination is rather complex. There are federal guidelines and sperm regulations to ensure recipients remain healthy and safe.
With HIV and hepatitis being big issues in terms of infection, it's important to make sure that sperm are healthy and that the woman receiving them is not at risk of infection. So there are very careful guidelines that we follow to make sure that the woman receiving sperm isn't in any way hurt by the process.
For some people, the thought of fertility clinics may be deterred by cost, but OHIP does cover the diagnostic evaluations and has for many years. However, if you are in need of IVF, you could see costs in and around $10,000. But physicians say the Liberal government has plans this year to cover the majority of costs.
But until now, or at least until 2015 when funding comes, there have been many couples who simply couldn't afford to move that last step towards IVF. So the funding won't cover medications, which are expensive, and we don't know the details yet. The government haven't announced those details, but we anticipate by the end of the year we'll see a change that will allow many couples to access care who currently cannot.
One Fertility has been in Burlington for the past 5 years and is affiliated through McMaster University. For more information, you can visit their website at onefertility.com. For Halton Insider, I'm Kristen Demeny.